November is American Diabetes Month, and Carole Radney from the Coliseum Medical Center is joining me to talk more about detection and some of the causes. Good morning to you, Carole.
Good morning.
Thank you so much for being in here,
My pleasure.
talking to us about diabetes, right?
Mm-hmm.
So what exactly is diabetes? Define it for us.
Well, diabetes is the inability of our bodies to be able to use sugar in the correct way. Carbohydrates, which are one of the food groups that we eat, they break down to glucose, just to sugar. Mm-hmm. And sugar is our fuel for our body. And what happens is our pancreas, which is an organ in our body, and it's one of its responsibilities is that it makes insulin. And insulin helps that fuel, that glucose, to get from our bloodstream into our cells to be used so that we can think and blink and walk and talk. And so what happens is either the pancreas quits making enough insulin, and that's insulin deficiency, or the insulin it makes doesn't work correctly, and that's tied into genetics.
Type 1, type 2, right?
Type 1 is juvenile diabetes.
Okay.
Those people, usually children, when they're diagnosed, make no insulin at all. And so they have to be on a pump or, several insulin shots a day. Type 2 is our typical adult onset. And those are the ones that they still make insulin, but just not quite enough, or their insulin doesn't work properly. And there's all kinds of ways we can treat them.
Now, you were talking about genetics earlier, mm-hmm. but we have a list that we want to bring up, mm-hmm. and you were talking about prevention, right? Mm-hmm. So what cannot be prevented, or what can help race, age, mm-hmm. genetics? So let's go down that list.
Okay, quick. Well, the things that are risk factors for you mm-hmm. getting diabetes, there are some you can prevent, and there are some you just can't help. Right. One of those is race. You can't help that. The races that are highest at risk are Native American Indians, and then we have, after that, our Latinos. After that are African Americans, and then Caucasians. Your age, the older you get, seems like when you get 40, you fall apart, but that's when we start seeing people with adult onset.
And that's when you have to have a doctor bring you back together.
Exactly right. And then genetics can play a role. If mama, daddy, sisters, brothers have diabetes, thanks a lot, mom and dad, for that gift, but sometimes that's how people can get
So what
diabetes.
Can help you? What are some of the things you can do to help your situation if you are, experiencing any symptoms mm-hmm. of diabetes?
Mm-hmm. Most of the time people don't experience symptoms. They get diagnosed at their doctor's office. So that's number one. Most important is make sure yearly that you're going and you're getting a checkup, and that your doctor's doing a simple test called an A1C. You don't even have to be fasting for that. That's how we usually diagnose these days, but we also can diagnose with a fasting blood sugar. So those two tests your doctors usually do, but you want to ask, am I being checked for diabetes? So that's number one, see if you have it. There aren't very many commercials on TV that show the symptoms. The symptoms are excessive urination, excessive thirst, extreme flu-like fatigue, right. And those are usually when we see sugars get really, really high.
Well, thank you so much, Carole, for talking to us about this. Mm-hmm. And if you want more information, you can visit www.diabetes.org. Stay with us.